Looking at a sprawling family medical history can feel like staring at a chaotic web. A disease might pop up in one generation, skip another, and strike random branches of the family tree without obvious rhyme or reason. But biological inheritance is governed by a strict mathematical code that functions at the chromosomal level. You can decode that pattern using a remarkably simple two-question algorithm. Analyzing a pedigree chart is an exercise in cryptography, translating seemingly unpredictable biological outcomes into fixed binary rules. This animated chart illustrates the first question of the algorithm. Does the phenotype skip a generation? We see a clear jump here from an affected grandparent directly to a grandchild. If the answer is yes, the trait is recessive. The individuals in the middle generation are silent carriers. They hold the mutation in their DNA, but a healthy dominant copy overrides it, preventing any physical symptoms. If the phenotype appears in every consecutive generation without fail, the trait is dominant. It only takes one copy of the gene to trigger expression, creating an unbroken vertical line through the family. Generational skipping acts as a primary filter, separating hidden genetic threats from overt ones. Once you know if the trait is hiding or active, question 2 asks, is there a sex bias in the affected individuals? If males and females are affected in roughly equal numbers across the board, the inheritance pattern is autosomal, meaning the mutation lives on one of 22 pairs of non-sex chromosomes. But if one biological sex is overwhelmingly targeted compared to the other, the inheritance is sex-linked. Tracking that ratio of affected men to women eliminates 22 pairs of chromosomes from the search and pinpoints the mutation directly onto the 23rd pair. X-linked transmission is a mathematically complex outcome that serves as the ultimate proof of how well these rules function. Fathers determine the biological sex of their children by passing an X chromosome to all of their daughters and a Y chromosome to all of their sons. If a father is affected by an X-linked disease, 100% of his daughters will inherit that affected X chromosome and become carriers. That exact same father will pass the disease to 0% of his sons, who only receive his unaffected Y chromosome. A father's biological sex creates an uncompromising binary, absolute zero risk for sons and absolutely certain transmission for daughters. Contrast this with the maternal path, which replaces rigid guarantees with randomized probability. A carrier mother has 2 X chromosomes, one affected and one healthy. Her sons have exactly a 50% chance of inheriting the affected gene and expressing the disease. Her daughters face the same 50% probability, but a second healthy X chromosome from their father means they will only ever become silent carriers. The paternal path dictates absolute outcomes, while the maternal path introduces pure coin flip probability to the genetic line. Combining these rules allows you to actively interrogate any multi-generational family tree. We can trace this affected grandson back through his carrier mother to his affected grandfather, confirming the trait skips a generation and exclusively hits the males. These 2 questions reveal the specific mode of inheritance governing the family line. We can see exactly how the trait moves, how it behaves, and who holds it. The algorithm organizes a confusing medical history into an actionable predictive model. Mapping genetic risk requires checking for generational skipping and calculating the sex bias. Ultimately, these complex genetic outcomes follow an exact, unbreakable mathematical code that is encoded deep within the physical structure of our chromosomes. Understanding these rules allows you to look past the chaos, calculate the probabilities, and predict the future of a family line.